Welcome to Global Economic Press, where we deliver trusted global finance and economic news, analysis, and reports, empowering leaders and investors with reliable, timely insights. I'm your host, Alex Brady. In today's episode, we're diving into the world of telehealth and the evolving landscape of GLP-1 pricing. We'll explore how Ozari Health is making waves with its updated pricing data for compounded semaglutide and tirzepatide, offering a transparent look at what patients are actually paying across the nation. Stay tuned as we unpack the details and implications of this development. Ozari Health, a New York-based telehealth company, today announced updated pricing data for its nationwide telehealth platform, where eligible patients are prescribed compounded semaglutide starting at $86 per month and compounded tirzepatide starting at $125 per month, all in with no membership fees and no long-term contracts. Alongside the update, the company released the new edition of its GLP-1 Telehealth Pricing Index, an open data set tracking what patients actually pay across more than 90 online GLP-1 providers. Headline prices in the online GLP-1 market frequently exclude mandatory membership fees, dose-based surcharges, multi-month prepay requirements, and auto-renewal terms. The pricing index records the true all-in monthly cost for each provider, alongside whether the provider names its fulfilling pharmacy, requires a long-term commitment, or charges fees separate from the medication itself. The updated edition captures a market transformed by federal pricing agreements and new Medicare coverage, giving patients a single verified reference for what GLP-1 treatment actually costs in late 2026. According to the updated index, all-in monthly costs for compounded semaglutide across track providers range widely, with many advertised prices doubling once required membership fees are included. Ozari Health's own pricing is included in the dataset on identical terms as every other provider. Patients comparing GLP-1 providers are comparing apples to oranges because the advertised price and the real monthly cost are often very different numbers, said a spokesperson for Ozari Health. We publish the index, including our own pricing, so anyone can check the math. The dataset is published under a Creative Commons Attribution 4.0 International Open License at ozarihealth.com/GLP1data and on Hugging Face, permitting free reuse with attribution by researchers, journalists, and patients. Ozari Health operates a nationwide telehealth platform throughout connecting patients with licensed, state-authorized providers who evaluate eligibility for GLP-1 treatment. Prescriptions are filled by the company's publicly named pharmacy partners: Hallandale Pharmacy, a pharmacy compounding accreditation, board-accredited 503A compounding pharmacy based in Fort Lauderdale, Florida, and Vials Rx, a United States licensed 503A compounding pharmacy based in Texas. Both prepare patient-specific sterile medications under United States Pharmacopeia 797 standards. Every medication label identifies which pharmacy filled the order, and patients choose their preferred pharmacy at standardized pricing. Before onboarding any partner, Ozari Health verifies active state licensure in good standing, United States Pharmacopeia 797 compliance, and quality documentation, with the full vetting criteria published at ozarihealth.com/pharmacy standards. The platform maintains Legit Script certification, a third-party verification requiring ongoing review of prescribing practices, pharmacy partnerships, and marketing claims. All care is 100% online. Availability varies by state of residence. Compounded semaglutide and tirzepatide are not Food and Drug Administration approved and have not been evaluated by the Food and Drug Administration for safety, effectiveness, or quality. All prescriptions require review by a licensed provider who determines whether treatment is appropriate for the patient's individual medical history. To learn more, check eligibility, or view the full pricing index, visit ozarihealth.com.